Assalamu alaikum guys and welcome to my YouTube channel Biology Articles and MCQs. Today we are going to start a topic that is kidney failure. Previously we were studying about the kidney diseases and the second disease we are studying kidney failure, which is also called renal failure. First of all, we will discuss that which points we will discuss in this video. First of all, we will discuss that what is kidney failure, then its causes, stages, warning signs, and its diagnosis. First point we are studying now that what is kidney failure. Kidney failure or renal failure means one or both of your kidneys no longer function well on your own. Kidney failure is sometimes temporary or develops quickly. That will be called as acute kidney failure, or other times it may be chronic, means it develops for long term and slowly gets worse. Out of the acute and chronic kidney failure, the chronic kidney failure is most worse because it is for long term and it will slowly get worse. Kidney failure is the most severe stage of kidney disease. It is very important to cure it, otherwise it may cause death. The next thing we are going to study is the causes of the kidney failure, that how will you get the kidney failure or what will be the main causes that will cause the kidney failure. So the first cause is diabetes. Diabetes, that is commonly called sugar. The diabetes can lead to, that high blood sugar level. Diabetes can cause a high blood sugar level, which is hyperglycemia. And the high blood sugar level can damage your kidneys and other organs, which can lead to kidney failure. So the patients mostly that are suffering from diabetes, it can also lead to kidney failure. The second most important cause is high blood pressure. High blood pressure ranges are there. It can also called hypertension. That normal blood pressure is 120 and 80. But in the high blood pressure, the systolic blood pressure can be greater than 120 and diastolic blood pressure can be greater than 80, which can also lead to hypertension, means very high blood pressure. Now, how high blood pressure leads to kidney failure? That high blood pressure means the blood travels forcefully through your body's blood vessels. Over time and without treatment, the extra force can damage your kidney tissues. Means if the blood is forcing your blood vessels and making a force on your blood vessel, and it can lead to kidney damage or damage to your kidney tissues. The third and most important cause of a kidney failure or renal failure can be polycystic kidney disease, PKD. PKD is a condition that one inherits from his or her parents. Means it is an inherited condition. Now, what happened in PKD or polycystic kidney disease, that some cyst like fluid-filled sacs will grow inside the kidney, and these sacs or cysts can also lead to kidney failure. Then is the glomerular diseases. Glomerular disease means that there is a first portion that is called as glomerulus in the nephron, means the capillaries that were surrounding women's capsule were glomerular capillaries. If the glomerular capillaries damage or inflame, there cause any inflammation in the glomerular capillaries and some blood vessels, it can lead to a condition that is glomerular disease. What happened in the glomerular disease is that the glomerular disease will affect how well your kidneys filter the waste. If the glomerulus capillaries are affected, then your body cannot filter the waste easily, which is an important task which is an important task that should a nephron perform. Then is the lupus. Lupus is autoimmune disease, and it causes any organ damage, and it can also cause joint pain or fever and skin rashes as shown here. These were the main causes of the kidney disease. Then if we talk about the heart diseases or liver disease, it can also lead to kidney failure. Next, we will talk about the stages of the kidney failure. There are total 5 stages of the kidney failure, and these stages are according to the estimated glomerular filtration rate, EGFR. Estimated glomerular filtration rate means that how much or how well your kidneys filter the substances. A normal estimated glomerular filtration rate is about 100, and the lowest estimated glomerular filter rate is 0. And the 0 filtration rate means that there is no remaining kidney function. Let's discuss these stages one by one. In the first stage, your GFR means glomerular filtration rate will be higher than 90. Normal value will be 100, but in the stage 1 of your kidney failure, the GFR value will be higher than 90, but it will be below 100. At this stage, your kidneys have mild damage but can still function normally. In the stage 2, your GFR may be as low as 60, or it can be as high as 89, means it will be between 60 and 89. You have more damage to your kidneys than in stage 1, but in the stage 2, your kidneys are still functioning well. In the stage 3, your GFR will be now between 30 and 59, means as far as we moving in the stages, moving further in the stages, the GFR value is decreasing. Now in the stage 3, it will be between 30 and 59. Now you have mild or severe loss of kidney function. In the stage 4, your GFR may be as low as 15, or it can be as high as 29, means it will be between 15 and 29. In the stage 4, you have severe loss of kidney function. Last stage of the kidney failure is stage 5, means it is a severe stage. Now your GFR value is only 15, means only 15% your glomerulus or kidney is working. Your kidneys are nearing or at complete failure at the stage 5. These GFR values means that you are filtering only that specific percent of substances in the by your kidney. Means if you have a normal kidney, the glomerulus or your kidney will filter 100% of substances. But moving towards the stages of kidney failure, the percentage of the filtration of the substances will start decreasing. Next thing we are studying now are the warning signs of the kidney failure. Means how you will get this information that you are having kidney failure. Then there are some signs of kidney failure. So first sign is extreme tiredness. You will feel extreme tiredness or fatigue. The second sign, you can feel nausea and vomiting. The third is no concentrating or trouble in concentrating on something. The fourth is edema. Edema means swelling on the on specific part of your body, means around your hands, or it can be around your ankles or foot or leg. Then there will be decrease in appetite, or you can taste the food metallic. And then is the sign, if you are having kidney failure, then you will feel cramps, or that are normally called muscle spasms, or then peeing more often. And the last one is dry or itchy skin. These are mostly symptoms of kidney failure. But the kidney failure symptoms vary between people. If your kidneys are not function properly, you may notice one or more of these signs. Then is the diagnosis, that how a physician diagnose that you are having kidney failure. The first test is the blood test. In the kidney failure condition, the doctor will take your blood test. The blood test will show how well your kidneys remove the waste from your body. A provider will use a needle to withdraw a small amount of blood from a vein in your arm, and the technicians will then analyze your blood sample at a lab. The second test can be done, which is urine test. Urine test will measure that specific substances in your pee, such as protein or blood. You will pee into the special container at the provider's office or hospital. Then the technicians will analyze your urine sample at the lab, and then decide that either you are having kidney failure or not, or which stage of the kidney failure you are. Then the third test is imaging test. In the imaging test, the provider or doctor will look at your kidney and the surrounding areas to identify the abnormalities or any blockages. Common imaging tests will include kidney ultrasound or CT urogram, or it can be MRI. The last thing we will study about the kidney failure is treatment of the kidney. The first thing is a dialysis. The dialysis can be hemodialysis or can be peritoneal dialysis. Here, the hemodialysis is shown. In hemodialysis, a machine regularly cleans your blood from you. Most people get hemodialysis 3 or 4 days a week at a hospital or a dialysis clinic. We will discuss the hemodialysis in detail in next videos. And the second treatment that can be done for the kidney failure is peritoneal dialysis. In peritoneal dialysis, the doctor attaches a bag. Here is a bag which is having the dialysis solution to a catheter. Here is a catheter shown, and in your abdominal lining. The solution, that is dialysis solution, will flows to the catheter into your abdomen, and it will absorb waste products or extra fluids and drain again back into the bag that is attaching to your body. Sometimes people can receive peritoneal dialysis also at home, but most people receive hemodialysis. We will also discuss peritoneal dialysis in detail in next videos. Here is the most common two treatments of kidney failure. Next, I hope you like this video. Share this video with your friends, and if you have any problem regarding this topic, you can comment in the comment section below. Thank you so much.